Welcome to the MEDS Conference. Whether you're a community college student or a UCSD student and you see yourself as a future doctor or pharmacist, we hope that you're going to leave the conference inspired and ready to pursue your dreams.
So last year at the MEDS Conference, I served on a panel and I was able to answer questions about the process of applying to medical school, personal statements, the experience, and what to expect. And those are the sorts of things that not everybody has access to.
Often students who come from diverse backgrounds sometimes don't have role models in the medical community that they can look up to and see as models for how they can go ahead and reach their dreams as well.
So what MEDS Conference does is potentially for folks that don't have that sort of mentor, that sort of person to look to when it comes to answering those tough questions and seeing how to do it themselves. It gives them a chance to interact with folks that share the same background, share the same identity, and help them visualize themselves in that same role that they aspire to.
So I attended the MEDS conference in 2015. It was a year after I graduated. I was really trying to figure out whether medicine was right for me because I had just graduated. I tried applying, I didn't get in, and so I really had to recenter myself and figure out, okay, is medicine really right for me? And so I attended the MEDS conference and I heard Dr. Luis Castellanos speak. He was one of the keynote speakers. He was great. I read his background. He attended Harvard, got an MPH, and I'm like, that sounds really interesting, something I want to look into. And so I approached him during the lunch hour. I asked him hey, so are you doing any research, or are there any opportunities for me to be a part of? He actually had some research going on with cardiac rehab. And so I was able to get a research position with him, and from then on I was able to really, build on my experience in medicine. He also served as a mentor for me because I figured that what I really needed was a mentor in medicine, because I had amassed mentors outside of medicine in academia, in different departments in chemistry, economics, but I really didn't have anyone in the medical field to actually ask questions or get a sense of exactly what is going on.
Serving on that panel made me feel really great to see so many black, brown, and beautiful faces, eager, happy, willing, and very energetic to engage and pursue a career in healthcare.
The huge benefit out of attending MEDS conference is actually having the chance to speak with physicians in practice, and you definitely get a lot of that during the social hours of the MEDS conference.
So my pathway is a little unconventional. After I graduated from college, I did Teach for America for 2 years, and then I really enjoyed my experience. I worked in South Los Angeles in the community of Watts, and I got to interact with a really diverse, rich culture with students and families that inspired me to be the best teacher I could be. And so I continued teaching and practiced my craft, and I ended up staying at my school for 5 years, and then I came to a conclusion that there's a lot of needs, health needs in the community that I was working in and at large, and I thought that maybe I should go into medicine and follow along my dad's footsteps and potentially give back to the community in a way that's a little bit different but still just as important as being an educator.
The reason why I want to become a physician is because I really want to help the underserved and definitely make a huge impact in my community as a physician leader. I really want to go beyond my role as a physician and definitely try to impact change in the policy sphere, and also just to do interventions in the community, really trying to bridge the gap in health disparities. But I will say that it really did all start in high school when I really was thinking about medicine, but I wasn't really sure if it was right for me, so I went to AMSA to learn more about the medical experience, and so I committed to trying to get into medical school my first year in undergrad. And then I had to say, okay, well, do I stick with math econ or do I switch to a science major? But I was just way too passionate about math and econ, and I couldn't let it go. So I decided to stick with it. But what I did do was I decided to study more about health economics and the healthcare system in the United States, and that really did interest me. And so with that, I was able to link it back with health policy, health inequality. So that is something that I'm really passionate about, and it's something that I hope to do as a physician. And it's the reason why I became a medical student. because I really want to, do both hands-on work, try to be in my community in Chula Vista and South Bay, provide medical care there. And hopefully years after that, I hope the healthcare system changes for the better.
I would absolutely recommend students attend the MEDS conference. At the end of the day, it is a great opportunity to interact with physicians from a diverse set of backgrounds that have a unique view and outlook on the world that might be similar to yours or might challenge your own. And in that opportunity, you get to learn, expand, grow, and sort of build a repertoire of information to pull from when it comes to applying to medicine, and also build your expectations properly rather than just diving down that deep rabbit hole that exists on Google in the wrong form with the wrong advice. This is people from medical school that are telling you exactly how they're experiencing medical school, and you get to learn from the source rather than from an anonymous source on the internet.
I definitely do think that anyone who is interested in medicine should attend the MEDS conference, because it really does give you the opportunity to hear from physicians in practice, get to learn from their experiences and really see if medicine is right for you. And then even after they're done giving their keynote speech, or if they're doing a workshop, you're then able to interact with them and get to hear what their experiences were during med school and during undergraduate. And I think that's pretty powerful for students to hear.
To get the most out of the conference, you're going to want to arrive hungry because we have a fabulous breakfast for you. And after that, you're going to dive right into hands-on experiences and get a chance to ask your questions and see what it's really like to be a medical student or a pharmacy student behind the scenes. Please come with an open mind with the idea that maybe you can do this too, because I think you're going to find out when you come to the conference that it's definitely a possibility for you as well.
Come to the MEDS conference with an open mind and with bravery to reach out of your comfort zone and ask questions that you would normally not ask, and interact with folks that you might not interact with. And this is not just limited to the medical students and the facilitators and the healthcare professionals, but also your peers. This is a great networking opportunity to meet new friends, meet new colleagues that, if you end up going into med school together or at the same time, the medical school world is a small world, and you end up running into the same folks that you interviewed with, and you might end up at residency later down the road at a similar hospital on a similar research project. There's so many opportunities for collaboration and network, so don't let the opportunity pass to step out of your comfort zone, extend a hand of friendship to any and everybody, no matter what phase of their medical school journey that they're on, their healthcare journey, whether they're a professional, medical student, or an undergraduate. There's so many valuable people to interact with.